Hi there, I am Chala Gupta, physiotherapist, specialist in orthopedics. Today I'm going to discuss an important topic which is the restless leg syndrome, RLS. Now, what is restless leg syndrome? Restless leg syndrome is the condition in which some people feel that they have stiffness in their legs, whole of the legs, right? Like they are unable to sleep at night. They complain that when I sleep at night, I don't know why, I feel that something is there inside my leg which is not letting me sleep. My leg is feeling restless. My leg is not supporting me to sleep. Or if not, then after waking up, they feel tiredness in their leg, and whatever they consume, whatever they eat, anyhow, while sleeping, this problem is not vanishing off. Sometimes people complain that when I get up off the bed, suddenly I am not able to get down off the bed because I feel the stiffness in my legs. This is because of the restless leg syndrome, and it is making me unable to sleep for some time, and as I walk for some time, then my stiffness goes away, but then there is always a tiredness in my leg. So these are the common symptoms of restless leg syndrome. They feel as if there is something which is very uncomfortable and my legs are not making me sleep. They will not be able to tell you what actually they are feeling. If you ask that person that, can you tell me that what you feel in this restless leg syndrome, or what you feel in your problem, so he will say that, or he or she will say that, I don't know, I am unable to explain, but my legs are very uncomfortable and I am unable to sleep with. So this condition is restless leg syndrome. Now, what are the causes of restless leg syndrome? Listen this carefully before starting out with the exercises of restless leg syndrome. The causes of restless leg syndrome is that mostly RLS is a genetic disorder, right? There's nothing to worry about it. Now, genetic disorder means it can transfer if your mother had to you. If your mother had the RLS problem, it can transfer to you, or not if your mother is not the carrier of RLS. Maybe your grandmother is, or maybe if not your grandmother mother is. So it can jump from one generation to another without affecting the middle generation in between. This is RLS, right? Now, the restless leg syndrome can also happen in people. Mostly 90% of the cases have been seen that it happens in diabetic patients. When you have diabetes, most chances is that you might have a burning sensation in your leg, and if not burning sensation, you might have the symptoms of restless leg syndrome. Maybe there is a uncomfortable leg, or maybe there is stiffness, or you feel like moving the leg all the time. If you feel moving the leg, you will feel comfortable. If you won't move your leg, you will feel stiff. So this is a common symptom of RLS, right? So diabetes is a condition. Now, the diabetes and the genetic problem, it cannot be cured completely, but yes, diabetes can be controlled but not cured, right? You agree with me, right? Now, seeing this factor, it is very important to do the exercises which reduce your stiffness. Okay, so to reduce your stiffness, so morning and evening exercises you have to do forever in case of RLS syndrome, right? So that you are able to cure your sleeping problem because of your leg. Okay, this is the only solution for it. The third cause of RLS can be the dopamine levels. If the dopamine levels in your body are reduced, then you might feel RLS. Now, dopamine actually, it helps in the proper muscle contraction of the body, right? If your dopamine levels are low, because of some reason which is idiopathic or which is pathologic, so it can cause the irregular muscle contractions and thus leading to RLS. Okay, the fourth cause is in case of anemia, if you are iron deficient. Now, in RLS, you can go for the hemoglobin test. That is a basic test. You can go for it if you want to, but even if you take iron medication doesn't mean your RLS will go away. No, because other factors might be involved with it that I have discussed with you right now. So the best solution for is that you make your leg flexible, you make your lower limb flexible so that you don't feel discomfort because of RLS. And it is very, very, very common in females, very common these days. Now, the RLS syndrome also occurs in case of menopause. Now, this is a common syndrome. Diabetes or dopamine level, uh, if dopamine level decreases, or if it's a genetic disorder, these are uncommon. But menopause, because of menopause, if the restless leg syndrome happens, it is common, right? So now, if you are about to have a menopause, and if you have already had menopause, but then after menopause, it takes 1 or 2 years to get accustomed, because body takes a lot of changes in it. So RLS is one of the common change because leading to due to menopause, right? So restless leg syndrome, these are the all the causes that causes it, right? Now, in this video, I'm going to tell you the exercises in two ways, right? The first way which I'm going to tell you is the lower limb muscle stretchings, the major muscle involvement and their stretches, right? And then I'm going to tell you the nerve flossing. What is nerve flossing? The nerve mobilization. In layman term, you understand in this way that, say for example, your muscle is very tight, right? Nerve and blood vessels supply your muscle, which in turn lead to contraction, right? So if there is a poor circulation, why is there a poor circulation leading to restless leg syndrome? Poor circulation is because maybe your nerve is compressing somewhere. It may be symptomless, it may be symptomatic. If there is symptomatic, it can be radiating pain, or it may not be radiating pain, only there may be RLS, restless leg syndrome, you feel discomfort in your leg. So why we are going to do the stretches? To make your muscle flexible, right? And why we are going to do the nerve mobilizations? So that, because nerve passes in between the muscles, the nerve is not like a rope. Nerve is a stretchable structure, right? It is a very stretchable structure. So when your muscle is tight than normal, right, then it lead to restriction of the nerve also. If your muscle is flexible, in turn you will mobilize your nerve, so the nerve can easily move inside the muscle. They can be easily sliding between the muscle and the nerve, because nerve is a flexible tissue. Okay, so I will be first telling you the 4 lower limb stretches and the three nerve mobilizations. Okay, in the video, do as I am doing, the same way, in same synchronization. If I'm doing it simultaneously, do it simultaneously, right? In the video, I won't be talking about how I am doing it. Just watch me and do it, right? Now, just watch me in the video that how I am performing the exercises for RLS. First, I will be doing the the muscle stretches, right? So this was the first stretch, which is the piriformis stretch, right? So you will be going to stretch it, hold it for 30 seconds, 5 times each side, or 3 times each side. Okay, start with the 3 times each side. Next stretch is going to be the hamstring stretch. So, in the hamstring stretch, do not forget to straighten your knee. Main part is as much as you can straighten the knee, right? Now, the third stretch is the quadricep stretch. So similarly, the quad stretch we are going to do on the opposite side, right? But I am performing it, I'm not holding it for 30 seconds. You guys have to hold it for 30 seconds minimum, because our GTU, Golgi tendon organ, get activated after 30 seconds, right? Now, the fourth stretch is the calf stretch. So we're going to lie like this, right? And then stretch. So this is the second form of the piriformis stretch, the one I have performed. And the calf stretch is, you are sitting like this and you are taking your foot back. But remember to straighten your knee, right? So you have to keep your knee straight and then stretch it back, right? Straighten your knee and stretch it back. So I can feel my calf muscles stretching away, or I can do it individually also, right? So piriformis stretch are of two types. One, which I have told you while lying down, this one, right? And the second piriformis stretch which I have told you is this one, right? And the calf stretch is sitting and doing it, right? Now, moving on to the nerve mobilization, right? So, how you will mobilize your sciatic nerve? Similarly, on the opposite side. So nerve gliding, you don't have to wait for it. Just keep on gliding your nerve, right? So minimum 10 times each side. Then is the common peroneal nerve, right? So common peroneal nerve, you're just going to lie down and lift your leg up, turn it inwards, right? Take it down. So, in common peroneal nerve, you have to make the component of inward rotation and knee straight. Keep your hip flexed as far as you can upwards, right? Now, the next one is the femoral nerve. So, you're going to lie like this and then do it. Okay, so these are the common stretches and the nerve mobilizations that you have to do to relieve your RLS. Remember that RLS is not a condition that you ask me that for how long I have to perform this movement. No, it's not a condition that you decide that for how long I have to perform a muscle stretch or how long I have to mobilize my nerve. No, you have to do it lifelong because it's a genetic disorder in most of the cases, and you require your stiffness and your symptoms to remain subsided. If you won't do, it will arise again. But medications is not a solution for restless leg syndrome. After all, how many times you will have painkillers and sleeping pills? It's not a solution, right? But this is a solution. So all the best, do these exercises and do it regularly. Make sure that even after 1 month, you are able to do 2 times a day. All the best, and if you have any questions, you're most welcome to ask me in the comment section of my blog. Bye bye.